Okay, so I think we can start. I think that's one of the good things about online roundtables, and it is that we can start on time. We are ready here from some time, some minutes ago. So I am Maria Bustelo. I am associate professor in the Complutense University of Madrid, and now at the moment I am the coordinator of a Horizon 2020 project called Supera, supporting the promotion of equality in research and academia. There are these projects called gender structural change projects. It's of course the first thing that I would like to say is to say a big thank you to Chris Desville, chair from the ECPR, who proposed me to do this panel about the gendered impacts of the pandemic, and especially the roundtable that we have put together, critical voices on the gendered impact of the COVID-19 crisis on policies, politics, and lives. I would like also to thank the ECPR staff who have been really helpful for everything. And of course, I need to thank you all the invited speakers, because they were very ready immediately. They said and they accepted my invitation to this panel. So thank you very much. I will, before starting, I will do a quick round of introductions for the audience to know who are there, although it is in the description of the panel, but I will do it very quickly. In order, alphabetical order, it's Agnès Hubert is an experienced policy maker and an author of EU gender equality policy. She has made a career as a high-level civil servant in the European Commission, and is currently associate researcher in the gender program of Sciences Po, visiting professor at the College of Europe, and president of the first European feminist think tank, Gender 5+. Elisabeth Klatzer specializes in research, advocacy, and consultancy in the field of gender-responsive budgeting, public finance management, as well as gender and economic policy. Her works include conceptual work on adapting gender budgeting to different national, regional, and local contexts. She has been in charge of the recent studies commissioned by the Greens group in the European Parliament, New Generation EU Leaves Women Behind, and she will be talking about that. Angéla Kóczé, sociologist. She is an assistant professor of Romani Studies, acting chair of Romani Studies program, and academic director of the Roma Graduate Preparation Program at Central European University. She is co-editor of the Romani Women's Movement, Struggles and Debate in Central and Eastern Europe, and some other work. Mieke Verloo is professor of comparative politics and inequality issues at Radboud University, and non-residential permanent fellow at the Institute of in Vienna, Institute for Human Sciences in Vienna. And she's the winner of the 2015 ECPG Gender and Politics Career Achievement Award. And she was scientific director of European research projects, and now her current research is on democratization and opposition to feminist politics in Europe. Finally, Sylvia Walby is professor of sociology and director of the Interdisciplinary Violence and Society Center at City University of London. She is also fellow of the Academy of Social Sciences in UK, and she's author of many books, among them Globalization and Inequalities, Complexity and Contested Modernities, Crisis from 2015, The Future of Feminism 2011, and The Concept and Measurement of Violence Against Women and Men 2017. Thank you very much to all of you for being here. What we are going to do is I will just do a very brief introduction about the general topic of this roundtable. And of course, the COVID-19 crisis has nakedly shown our vulnerability and our need of caring for each other, and the importance of sustaining life beyond production. It has also brought in a quite more evident way than before that we need a sustainable life, and sustainable life, it's much more than the working or the arrangements that we normally have for working, which are gender blind. And of course, it has put also into the forefront the crisis of care that feminists have been problematizing and claiming already for some decades now. Of course, we need to analyze the pandemic with a gender lens. And we need to do it because what we see is that not only is the impact of the crisis, and we already saw that in the 2008 crisis, but also, and that's what we will see also with Agnès and Elisabeth and with all of them, is that the very policies and measures that we want to do for that, if we don't see it from a gender perspective, we will keep on reproducing and maintaining those inequalities. So that's what we will try to do in the following hour or so. Okay, so I will ask first, what we are going to do is to have a first round of 5-minute interventions of each of the speakers. Okay, about the different gendered impacts that we are going to put into the table. And we will start with Sylvia Walby, and she will expose problems posed by the confinement of gender domestic violence, but also what, Sylvia, what you call that, I think it's really interesting, the gender of R, that is how the transmission of the virus along gendered pathways has been underestimated. So Sylvia, whenever you want, please.
Thank you very much, Maria, for the introduction to this terrible panel. So we're discussing gender and COVID, and we're discussing the impact of gender on the experience of COVID and the impact of gender on the transmission of COVID. So the first part is to think about the disproportionate impacts of COVID on gender. This, of course, is quite complicated. On the one hand, men die more than women from COVID. And on the other, women have disproportionately suffered as an outcome of some of the measures which have been used in order to attempt to suppress COVID. So some of these issues of gendered economic inequality have got worse as a consequence of some of the attempts to suppress COVID. Women are the ones looking after children at home and trying to run both a work and a care life. The confinement to the home has tended to increase the rate of domestic violence and abuse. So we've seen detrimental impacts on women and men in different ways from COVID. But I also want to talk about the impact of gender on COVID for everyone. That the neglect of gender inequality means that our policymakers have underestimated some of the key sites of transmission of COVID, and their ignorance and neglect of gender inequality has led to a higher death rate than we need to have had if they had been aware and had the knowledge of the gendered nature of some of these transmissions, and some of the ways in which they've attempted to suppress COVID have also been ineffective because of their lack of knowledge or the lack of deployment of the knowledge in how gender structures those pathways. So I'm going to talk about, as Maria says, the gender of R, the gender of the reproductive rate. How does gender structure that? I'm going to take as my main example the relationship between the individual, the household, and care in the context of an attempt to suppress the reproduction of COVID through strategies of isolation. So we all know that one of the major ways to attempt to stop the spread of COVID is to reduce social contact. And in order to reduce social contact, we should be separate. And this is especially important when somebody is actually infected or might have a high risk of being infection. So what do? We say a person should isolate or be quarantined. But do we really mean isolate? People get sent home. Home is not self-isolation. Home often involves several people. Several people are in that household. We send a sick person home to infect their nearest and dearest. Why? Why isn't self-isolation isolation? Why isn't isolation actually the full separation of the person who's infected? Why do we send them home to infect their loved ones as if there were no distinction between the individual and the rest of that household? I suggest that that's a consequence of an insufficient thinking about gender, in that our policymakers, our modelers, are still conflating an individual and the household as if there were no distinction. This has been especially troubling some of the modelers who, in their wonderful epidemiological models, don't make sufficient distinction between the individual and the household. We've also seen this neglect of gender taking place in issues of care. The assumption is often that an individual cares for themselves, but we know that's not true. People care for each other in households. People also care for each other between households. There's a lot of intergenerational care between households. The care of children by grandparents, the care of older parents by their children. Unpaid care. We've also got paid care in care homes, paid carers walking between different people's houses. Our care system involves lots of mobility and lots of interconnections. This has been severely neglected. We've seen the outcome in extremely high rates of death in care homes, which absolutely should not have happened. And it was the neglect of the care sector, the neglect of the understanding of the significance of care in how we think about society, which led to higher rates of death than there should have been. And that's as a consequence of gender imbalances in decision-making and gendered epistemologies. Our epistemological infrastructures have neglected those forms of science where this knowledge was located. In Britain in particular, our so-called SAGE committee, which put together the so-called top scientific advice, had very little social science, didn't have experts on care, didn't have people who run the care homes, barely even had public health. The people who dominated the epistemological hierarchies were those who had forms of abstraction which didn't adequately differentiate between individuals and households, let alone catch the significance of care until very, very late. The problem is the gendered epistemological hierarchies, the gendered imbalance in decision-making, which gave rise to a neglect of issues of care and to higher rates of death than needed to be the case. Gender matters in understanding COVID. Thank you.
Thank you so much, Sylvia, for this sound thing, about care and this thinking, this deep thinking about it. Mieke Verloo will explore gender and sexuality issues in academia and how the pandemic might affect the strong opposition to gender movements we can find in Europe nowadays, and maybe some other things. Mieke, please, whenever you want.
I fully support what Sylvia has been saying, and probably when the other participants to the panel have ended, I will fully support what they say too. So we can only highlight one or the other dimension. So what did I choose to highlight? I think what I choose to highlight is that while in a certain way this whole crisis and the responses to it are just business as usual, this is not a revolution. What happened is what the crisis is exposing is the system that is there, and to some extent the problems that result from that were there before, only now people die because of that. Only now they are so it's like problems as usual squared, but they are all part of the system that is there. And one of them has to do with what Sylvia has been saying, which is that our neoliberal democracies are based on a false idea of individuals as self-supportive and self-sufficient, which has never been the case in any way. So there is a neglect of the fundamental interdependence of people that is resulting in, I think, this neglect of care and the low value of care in the first place. So this failure, let's say, to build in the fact that we are interdependent, all of us, is what is causing some of these problems. So there is some kind of false assumptions underneath the functioning of our neoliberal democracies. And one is this failure to see interdependence as real. The other one is the failure to accept that there will always be fundamental insecurities, fundamental ontological insecurities in our lives. And what this results in is a politics with debates between people that all are somehow forced to act within that system as if they know for sure one or the other thing. Now, in many ways, we will never be able to know for sure. I think to a certain extent, what we need to come to what we need to be able to acknowledge is that there will always be this fundamental ontological insecurity. But this failure to do that also means that the ontological insecurity of people in the world is also neglected. No, the fundamental insecurity of people in the labor market in all these precarious positions is neglected because there is a false assumption that if only they would have done as a person did this or that, they would not be in these positions of insecurity. So that's underneath the failure to acknowledge systems of discrimination, systems of exploitation. So what does it mean for what I want to say is that in terms of the effects of the COVID crisis, what matters is that almost all the opportunities for movements of social justice to try and make progress in one way or another are getting worse because of the more differently or heightened contestation about the role of the state between two opposing polarized camps, between this changing or magnified role of expertise, where exactly the same types of expertise that supposedly know everything for sure, like the people that make models based on households where they do not want to doubt whether that is good because it's the way they've always done something. And so I think this is very worrisome. That we have less opportunities because the states are busy, A, with the crisis, B, with figuring out what kind of role they should have in heightened political contestations about the role they could have. It's the same with the experts. And in all that, I think with gender, we're on the relatively favorable end of all this because we're a kind of inequality that at least makes it to a roundtable at the ECPR. So that means that other inequalities are even in a worse position. That's it.
Okay, thank you so much, Mieke, also for keeping your time. Angéla, please. Angéla Kóczé will, will offer an intersectional perspective that I think it's very much needed in this panel. So please, Angéla.
Thank you so much. Thank you for the organizer to inviting me to participate at this panel. I just would like to continue actually on the same line which was started by Mieke, that basically the COVID-19, it's a kind of metaphor to creating deeper inequality, insecurity, and strengthening the deeper discrepancy, racial and gender and class and sexualized discrepancy in our societies. An impact of COVID-19 is never just about gender, is never just about a gendered crisis, it's never just about racism, it's never just about classism or sexism, it's always a combination of several oppressions that create intersectional obstacles for Romani women, what happened to be myself as well, and I'm working on that field, but many other racialized women's what facing intersectional oppressions in our society. And actually in the midst of our current ecological, public health, social, political upheaval, which can be understood as a crisis of late capitalism or neoliberal capitalism or precarity capitalism, as it was called by Asmanova, and Romani people have become repoliticized, re-racialized, re-instrumentalized through securitization, the construction of gypsies, gypsy criminality, gypsy threat, gypsy menace, and this is it's really threatening on our communities. And in this kind of sharp escalation of the racialization of Roma, a majority of even progressive scholars, that's why I think it's really important to talk about what the academia is doing, what kind of language we can construct and how can we address. So even the progressive scholars have been unable to articulate the centrality of race and racialization in the production of structural violence in neoliberal economies. And furthermore, they have often reinforced the colorblind, universalist ideologies that mask the enduring structural racism and violence against Roma. All too often in research studies, racism interpreted in a very narrow way, in a very narrow sense, as an individual moral wrongdoing, as opposed to being structural in nature. And I think it's really important to talk about the structural violence. And actually we had a lack of sociological imagination. I just referring back to C. Wright Mills, who conceptualized as a vivid awareness of the relationship between experience and the wider society, right? So we had a very, vivid experience which has not been really captured by academic discourse and contributed perhaps unwittingly to the invisibilizing and silencing of racialization that become a very powerful weapon in the hands of ethno-nationalists and extreme rights who tacitly instrumentalize anti-Romani racism to enhance the structurally embedded neoliberal racial order. I just thought that it's really important to talk about this broader picture, even in the context of COVID-19 crisis, because that's the basis, the underlying basis. What we can see right now, stories, what's going on with Roma has been invisibilized, or we have no statistics, we can't really talk about it, we can't articulate, because we can't capture it as a social scientist. And just referring some statistics, actually, when we are talking about Roma in the situation of COVID-19, how they could be impacted. Just imagine a population that Roma, who are like between 10 and 12 million in Europe, some 80% of Roma surveyed live below the country's at risk of poverty threshold. Every Roma lives in housing without tap water, without running water, right? Every third Roma child lives in a household where someone went to bed hungry at least once in the previous month. And 50% of Roma between the ages of 6 and 24 do not attend school, or those who attend, the majority of them attending a segregated school. So they are in a segregated classroom in a mainstream school, right? So can you imagine how does it affect these kinds of communities who might not have home to stay, to isolate themselves, who might not have a running water to washing hand in every 5 minutes or 10 minutes, right? And yes, so how can we address these issues? Can we enough brave to go beyond the usual business, right? Or the usual discourse, what we are using. And I think it's time to do that. And do I still have a few minutes? Just one minute? Okay, then I'm not gonna, I wanted to say about a few cases actually, which is collected like in Romania, Slovakia, and Bulgaria, how government used the COVID-19 basically scapegoating Roma and go against them and use some kind of, you know, militaristic intervention instead of humanitarian one. And anyway, those who are interested in these themes, the Central European University Romani Studies program, together with the Harvard universities, we started a webinar series to talking about the impact of COVID-19 on various local Roma communities. But thank you so much. Thanks.
Thank you, Angela, for this metaphor for you know, deeper inequalities as the pandemic like that, right? Agnès Hubert will explain the study and the paper that they have been writing with her group, the G5+, on the impact of the pandemic and its aftermath on gender equality in the EU. Whenever you want, Agnès. You have to unmute. Agnès, you have to unmute first.
Okay. Thank you, Maria. And thank you very much for organizing this, this roundtable. I mean, obviously the picture is very black, but we really need more debates, more discussions, more data on this gender impact of COVID. I mean, when I say we, it's with various groups, we got sort of quite concerned sort of early on. And I'm going to draw not only from the paper of G5+, which will be launched sometime in September, but which is longer and more detailed, but as well I'm going to draw from a short paper that we wrote with Jane Jensen for EXA, the European Community Studies Association, and from as well the short exercise, video exercise we did at some stage through our anger to hear so little women around. And we did it with Ruth Rubio-Marin and Lina Galvez. And that was just a sort of little video exercise on Women's Europe, Voices in Times of COVID, where we asked sort of feminist people to actually express themselves or say something about COVID. Anyway, so where shall I start? I mean, I do think that I mean, it is obvious that the COVID crisis has increased inequalities. I mean, all your sort of all the speakers before have sort of underlined specific aspects, but it has really increased inequalities. I mean, through sort of lack of consciousness of the of gender and lack of taking into account gender. It does. I mean, there's sort of 5 points I'd like to make. The first of all, there's the sort of. I mean, it does sort of as well increase the visibility of certain inequalities, particularly on the labor market. It has made visible a number. I mean, not only the fact that there are sort of women are in precarious jobs, but as well, these precarious jobs are the most essential jobs to survive. So it was the retail, the sales, the hospitality. I mean, all these sort of frontline sectors, not to talk, of course, about health. And when I'm talking about health, I'm not only talking about sort of doctors and nurses, where there's a lot of women, of course, who are sort of really frontline, but all the cleaners, the food providers, etc. I mean, and all the carers. And when I talk about carers, the paid and unpaid carers. So there's been a new sort of, I would say maybe short-lived visibility of all this sort of women workers who are sort of suddenly appear to be very essential people, right? It will be interesting to put it in relation with the work that Elisabeth Klatzer has done on what are now the sort of, where is the money going to be put? And it's not necessarily, it's certainly not in these sectors when we talk about the money of a new generation Europe. The second point is the new light which has been drawn on the unequal distribution of homework. One would have thought that, I mean, men were sort of staying at home, so there would have been more sort of more equal sharing, but it has really been the case. Most of the work has really sort of fell on the on women's shoulders. The question, without any childcare, without any schools, for nursing the sick, as Sylvia was mentioning. I mean, all this has been on top, really, of most of women's work, including the telework they were doing, right? And it has been sort of reflected as well. Some studies are coming out now on the sort of on their health condition as well. So I'm sort of talking about a large number of studies have been done by the UN, by IGO, so I'm drawing from all of them, which were really reviewed in our G5+ paper. The third point is the question of reproductive health and gender-based violence. I'm going to put them together for the sake of being short, but even though they wouldn't sort of both need sort of heavy developments, right? The question of reproductive health has been very much sort of put aside. Any type of sort of abortion pill sort of giving, etc., has been really made much more difficult, and the question of domestic violence has become as well as an issue. So the fourth point is the question of anti-gender policies, mentioned in particular by Angéla already. But I mean, it is true, it has weakened the fight against the anti-gender movements, right? We're not talking, I mean, yeah, we should be talking about measures taken by the Hungarian government or the Polish government trying to sort of come back on the Istanbul accession, etc. And it seems that in such a sort of crisis period, there was nobody, but I mean, people, civil society movements were there, which is one of the good things. The last point, which I'd like to make, I mean, is really sort of, I mean, is linked to what Sylvia said as well. I mean, gender matters in understanding this crisis. And it seems that there's quite a few studies and research which are showing that female leadership has been more effective in sort of dealing with the crisis, right? There's been 1/6 less dead in countries where there was a female leader. Is that just by chance? No, it's probably not. The way women have been sort of dealing with the crisis has been more empathic, has been more concerned, has been more sort of in a solidarity way, etc. So this was my last point, on which there is where I see, even amongst feminists, I'm bringing some sort of I mean discussion points there. I mean, even amongst feminists, it seems that question of female leadership is often sort of pushed away because it brings back to essentialism, and we cannot sort of sort of say that women are better and so on. But I mean, there is more and more research which is coming out on that as well. Thank you.
Okay, thank you so much, Agnès. So Elisabeth, please, because we are eager to know what you, identify as leaving women behind in the next generation EU. Please, Elisabeth.
Thank you very much, Maria. Yes, indeed. I will be talking briefly about the study which I did together with Dr. Azurra Rinaldi. It is exactly as Agnès put it, looking at where is the money going, the additional EU money in response to the COVID crisis. So here a brief overview what has been proposed. So we are talking about a significant amount of money, the regular multi-annual financial framework, which is guiding the budget for the next years, which is 1,100 billion. And in addition, and that's the particular COVID response, is the Next Generation EU, a temporary reinforcement, which is considerable, 750 billion, out of which 90% go to the Recovery and Resilience Facility. I will be coming back to that because it's of significance in assessing gender impacts. So some of you might have followed the talks and dynamics around the European Council in July, where there has been quite a few contradictions and discussions about the funds. Overall, the size of the funds hasn't been changed. It's just the question of how much goes as how much is going to be non-payable, repayable grants, or how much is going to be credits, which has gender implications, but not the key ones. I want to go straight ahead, as I have little time, to highlight a few aspects. We have heard a lot about the vulnerability of the economies, about gendered impacts. And just to highlight from an economic side, we know about the sectors most affected and highly affected by the corona crisis and how many women are there. That's the graph on the left side, where you see in general it's high shares of women employed, apart from all the women in the unpaid sectors and activities. And if you look at the focus sectors of the EU funds, you see clearly that it is not the ones which are the most affected. And by the way, it's not the care economy also supporting unpaid care, but it's rather construction, agriculture, transport, and information technology, etc., where you see you have high shares of men working. So we see that this focus of the next generation EU on investing in digital and green economy is highly gendered, creating primarily main jobs, and in these sectors which are heavily gendered, not even there talking or addressing gender issues. And more importantly, or as important as well, there is no adequate responses for sectors highly affected by the COVID crisis. So this is not only reproducing inequalities, as it has been said so rightly by Sylvia and others speaking before, but policy responses are bringing inequalities to new levels and reinforcing it in several aspects. Let me just make one argument, because there is so much talking about lack of understanding, etc. I think it's less about understanding. It's more a willingness. Anyhow, what we see in the response is that actually the response is going against economic logic, because the claim of the EU Recovery Fund is to create more jobs. What we see on this slide is that investing in construction, and the same holds true and much more so for digitalization, this is creating much less jobs compared to investing in care. Feminist economists know that since a long time. And by the way, this slide comes from a study done by Sue Himmelwhite and Jerome de Henao, who have been working on this, which basically says investing in care doesn't only create much more jobs overall and more jobs for women, but almost equally as many jobs for men as does investment in construction and others. So it's what is being done is also from an economic point of view doesn't make sense. So what we are talking about is more about what interests are catered for. So let me briefly, as a second point, take this European Recovery and Resilience Facility. Remember, it's about 90% of Next Generation EU. So it's highly relevant. It has been increased by this July European Council proposal. And the key aspect here is it's linked to the European semester. We know from feminist analysis of the European semester that it is not only gender blind, it is pursuing tight austerity. It is pursuing, and the mechanisms are responsible for cuts in services that are crucial, especially public services in healthcare, flexibilization of the labor market, etc. The then president of the European Commission, by the way, because somebody mentioned the question of whether we are talking about revolution, Barroso, the then president, when the European semester was introduced, said, we are talking about a silent revolution. And that's actually what has been taken place the last decade. It is a silent revolution which has created a mechanism of reinforcing neoliberal interests and reinforcing the neglect of care, the neglect of public services to promote more equalities. So it's very important to look at these mechanisms, and that's, I know, a little time, but that's this last element of why is this European semester so crucial, and why is this highly, highly problematic, not only from a gender aspect, this linking of the EU COVID funds to the European semester, but also from the question of being able to create a care economy and a way out of the crisis. There is a problem of power concentration and whose interest gets hurt. The European Commission and very much male, masculine dominated economic policy groups get a big say and get a control over member states' economic and budgetary policies, which is not only gender blind, but very undemocratic, because it's not elected democratic bodies. Neither European Parliament nor national parliaments, or not much less local or regional, who have a say, but intransparent, masculine-oriented bureaucratic institutions. And of course, I think I mentioned it, it's not only not taking account of the care economy, but going to the contrary with a very narrow gender blind conception of the economy. And just as a last point, when analyzed the last decade of the European semester and the EU policy recommendations, for example, the European Commission asked member states for cuts and privatizations in healthcare 63 times. And that was not the only aspect of recommending of dismantling public services and reducing funds for what is care economy. There is many other areas in the labor market, in education, etc., where this has been ongoing. So overall, very problematic. And as a last point, the European Commission, which supposedly with the new president is so gender equal, had even attempted with its proposal from May to cut the only program where there is somewhat of gender equality funding disguised, but still there, the justice, rights and values programs. They cut it in their proposal from May by 20%. There has been an outcry by parliamentarians, etc. These cuts were withdrawn and just installed to the very low previous level. But so it's interesting to see that. And when we talk about the European Institute of Gender Equality, it's also peanuts, but we have to see it's low, 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 the least funded of all decentralized agencies. So we are talking about problems at many levels. And in the second intervention, I come to recommendations. Thank you.
Thank you, Elisabeth. Okay, I was going to show some data for the in the academic realm, but I think I won't do it because I don't want to take any time from you. Just saying that with this survey that we did from the SUPERA project, we really confirm the aggravated inequalities also in the academic realm with this COVID-19 crisis. And overall, the idea that the female academics really have a much tougher time than their male colleagues. For example, the academic time usage perception, because this was the perception, was really much more for women than for men during the confinement, during the lockdown. So it's very interesting. We have only the preliminary results. I think we will try to get it, but it's really confirming. And also the idea of gender roles also in the academic time usage, that's something that we need also to address. That is, female researchers have claimed much more time on teaching activities and attention to students, and male researchers to writing papers and articles. And that's really, this is really confirmed. Everyone has spent more time during the confinement for the academic work. So everyone has done a lot of effort, but really female researchers have done it really much more, and especially young researchers. So that's also this inequality access of age that I think it's important, junior or senior. So just to say the same as the journals, that as you know, I mean, the important thing with the journals is not only that some journals have seen this decrease of 30% of submissions by female researchers, but that they have had an overall increase of articles sent and submissions. So really, I mean, the gap really of the men taking advantage of the confinement for being more and producing more, and women just on the contrary and really having hard times. Okay, if we have time, and I will show some data. So now we have this about it. This has been a wonderful kind of overall picture. What can we do now? Okay, what can we do to mitigate that, or what is the next steps? Okay, so Sylvia, please.
So, solutions. It's a time of crisis, which means it's a time of change. All sorts of changes. That's the nature of a crisis. There can be potentially extremely large changes in a very short space of time. The coalitions and intersections of multiple forms of inequalities really matter at this moment. So we've got contrary directions of change currently going on in our different countries. We can see the rebirth of Keynesianism in places where we never dreamt that we would see it again. Elisabeth had just given an account of it inside the EU. We've seen it in many countries, massive state expenditure in attempts to support economies and healthcare in the times of crisis. We've seen the loss of popularity of some of the right-wing governments as they have failed to stem the deaths from COVID. We've seen this both in the US and the loss of popularity of Trump. We've seen it in the UK with the loss of popularity of the Johnson regime. These are two countries where the death rates from COVID have been extremely high. So there are changes which in some way might look as if they're moving in a positive direction, but look under the surface, as Elisabeth has just done, and you look again, and you can see, for example, in the UK, we are seeing some restructuring, reprivatization, and securitization of things which previously had not been subject to those pressures. So we see in the UK the development of a biosecurity centre, which is going to hold data, which might otherwise have been considered the business of public health, which is much more often associated with more democratic, more social democratic, and more decentralised practices. So we're seeing the development of practices around data, positioned inside a securitized framework, rather than within the more social democratic public health framework. So we've got extraordinary contestations and contrary movements currently running inside the states at multiple levels: local level, national level, and EU level. Gender is part of that. It's part of that rethinking of what that future might hold. Let me turn to the epistemological infrastructure that I mentioned earlier, which I know Mieke also works on. What does it mean to think about that being restructured? We know the knowledge is already there. We know that feminist academics have worked for decades on the nuances and understanding of the issues around care. We had all of the information that was needed in order to inform the policies which could have prevented the deaths in the care homes, which could have prevented these excessive deaths. And we were not able to mobilize that information inside the hierarchy of epistemologies and the hierarchy of decision-making inside the intersection of our politics and our knowledge. So if we're going to look at a point of change and sitting where we are inside the universities, one of the questions is, why has the knowledge which has been developed over decades, such expertise, not managed to find its way into the public domain and be mobilized effectively? So I can sort of set that up as a question. Potentially it's a solution if we could find an answer to that question, but one of the solutions is to mobilize the knowledge that we have. It's not as if we're starting from scratch. It's not as if things are not already in flux. There are major changes going on. Could this be also part of it? If I go to a slightly more detailed level, then what would it mean for very detailed policies, shifting of the positioning of the hierarchy of knowledge? What would it mean to, for example, draw lessons from Asia about how they developed practices of real isolation, of really supporting the people who needed to isolate and support them? Other countries of the world have done it better. Cross-national research, learning from other parts of the world. What do we need to support the people who are experiencing the poverty of the isolation? We need the gender budgeting. Groups have demonstrated the significance of income support. This specific lack of income support among the extremely poor, who are the people who are most likely to be experiencing the worst aspects of the sicknesses associated with COVID. They're precisely the places where the most income support should be going, and it's where the least is. Now, the social democratic public health response to this is to say, if one's sick, we're all sick. It's really important to hang on to that vision of society as integrated. And the public health, which is really part of a social democratic vision, which is we cannot cure ourselves of COVID if you imagine you can just rescue a few people and shield a few others. This is something where we really all are in it together, and we really do have to hang on to that vision of that if one is sick, we are all sick, and that looking after the health of the poorest, the most vulnerable, most marginalized is really important for everybody. We need that vision, as well as to be able to articulate in detail what exactly it means. What does it mean? Statutory sick pay, who should get it? The furloughing funds extended to those people who wouldn't normally have access to pay. The detailed access to provision for fleeing from households when they're subject to violence. We need the very detailed policies, as well as capturing the vision, and to be able to mobilize all of that potentially offers us at least something to do and to contribute towards a solution. Thanks.
Thank you so much, Sylvia, for posing that question about why this this gender expert knowledge has not found its way, right, to do it. So, Mieke, would you like to keep on thinking about what we should do?
I don't know who the we is in that question, actually. So I think I would see the we in that question as engaged scholars or something, because that's otherwise it doesn't make sense. I think it's not just we as academics, it's not just we as women. So I think on the one hand, what this crisis has shown is that there has been quite a high visibility and leverage of social justice initiatives and movements at the beginning of this crisis. Just as you could expect, a crisis would create these kind of openings for people to expose the flaws in the system. So I think Black Lives Matter, you think the initiatives on basic income, they've risen to some kind of higher prominence than they were. Demands for universal healthcare in countries that did not have that, and exposing flaws in healthcare that did not get attention. So there is an enormous amount of energy in society of people that want to use this crisis to help cure the other crises within that crisis that our societies already suffered from. So the question what we should do is how can we support those kind of movements under harsher political opportunities than they had before, under harsher economic opportunities than they had before. So I think Sylvia had one of the obvious answers, like, well, try and make democracy functioning again, try and make social democracy functioning again. At least you will tackle some of these issues of economic, social, and political insecurity that make it much more harder for social justice movements to try and tackle these kind of issues. So I think I would ask the question in that way. So of course, this also exposes the failure of political scientists to give proper attention to social movements and what they do in our societies. It's been left to sociologists. It's always some kind of at the margin of our discipline. I think this is not right. I think we need to make that a more focus of our study. And the other one also pointed at by Sylvia is to study more the politics of knowledge in our societies as part of politics, which is rarely done in a certain way. And this crisis has again shown that the choice of experts matters tremendously, that marginalized knowledge remains marginalized, that the cost of the marginalization of certain types of knowledge, this is not only like gender knowledge, it's also knowledge on racialization, on, so it's all this knowledge related to inequalities is somehow never as prominent as other types of knowledge. For instance, in political science. So I think we could support all of that so that we can, it's the same with sexuality politics, is never seen as a fundamental part of political science, is always at the margin. So all this needs to be changing. I think we cannot have a political science anymore that gives so much more attention to elections and let's say the simple functioning of democracies and less to the real functioning of democracies where it really matters for what happens in societies. And I think underneath that, I think we can all try to increase the agency of people in these movements by inviting more scholars that are at the same time also engaged in movements in our panels so that their knowledge at this intersection between activism and academia enters our communities. So that's kind of, but connected to that, I think it's not, I had looked at whether, you know, different types of responses of states to the pandemic might matter, no? And I had come to find a typology of 3 state responses in a report by Sexuality Policies Watch that I liked very much, going back to Foucault and adding Sarrazin, which say this is the model of the leper, isolate, the model of, what was the other one? The smallpox, like it's more a surveillance model. And then of course there's the model of the herd immunity. You just let everyone be killed that is vulnerable anyway, and then you can start all over again. But I do not think that those have really different inequality effects. I think all of them come down to that essentially the vulnerable are most at risk. And it's the same type of people that are vulnerable for surveillance, for isolation, and for this herd immunity project. There are some differences, but I do not think that this type of responses matter so much for what happens. They matter, of course, to the extent in what they can be used by autocratic regimes. But so I think it's better to function, it's better to focus the response on increasing the options and the agency of social justice movements.
Thank you so much, Mieke, for reminding the importance of social movements and for asking who are we. That's really nice to think. So, Angela, I will just, because there are some people asking if we will have questions and answers for trying to save some time. Try to keep please to the 5 minutes, Angela.
Yeah, so I try to be short. So actually, I don't want to be too much pessimist, but somehow I think it's really important to recognize. Just think about the COVID-19, that this banner, social distancing, right? I mean, of course, it has been challenged because we know that social distancing is different from the physical distance, but social distancing, will it be a fulfilling prophecy, right? Through the COVID, I mean, just think about what I was talking about, the strengthening inequality and using the COVID as a kind of laboratory to create a greater gender, racial, class disparity in our society. We really have to, come together, and we really have to have a kind of joint vision about humanity, right? And in emphasizing what Sylvia was talking about as well, the interdependence, right? If one is sick, all of us is sick. And I think on that line, I really think that we can't postpone, I mean, going back to the academia, and, I don't want to go into the detailed policy recommendation, because certainly there are a lot, what we have to take: social measure, educational measure, health measure, and we have to talk about the basic income, and we have to compensate the income, not just for those who are having a real job, like in the white economy, but also ensuring the income for those who are working in the informal sector, in the gray economy, which has not been recognized. That's why it's important, the basic income, and we have to talk about the accessible universal healthcare and so on. So I don't want to go into that details. Rather, I would like to go back to this, epistemic justice and the epistemical level, which is really important in the academia. And I think we cannot postpone the recognition of the chronic, racialized and gendered dispossession, which is against Roma, against many racialized peoples, which generationally and even to this day has taken a huge material, intellectual and emotional toll on those who are living in the midst of a devastating situation in the middle of Europe, right? And Europe must allocate resources to compensate the historical injustice of Roma. And certainly in the academia as well. And as we heard from Elisabeth, how European Commission wants to address the situation of COVID, and we have to change this kind of perverse logic and this kind of comparative distribution of public goods that benefits and rewards those who are structurally well-positioned and further disadvantages the most marginalized. This further disadvantages the voice of the marginalized and further disadvantages the care system, what we need. And the COVID proved actually that these are the sectors with what we rely on. And if we want to re-envision Europe, neither the feminists nor the anti-racist Romani movements can afford to ignore the intersectional lived experience of the vast majority of Romani women or other racialized women who are in a continuous life and death struggle for survival and emancipation, like, going back to Foucault, who has a right to live, right? And I would like to invoke Kimberly Crenshaw, very renowned legal scholars, insight: we must center our intersectional politics of re-envisioning on those who are in the most disadvantaged situation. It's very much resonate what Sylvia told. The reason is that if we start to develop a language, politics, that resonate with the situation of the lived experiences of the most disadvantaged amongst us, then this will provide the critical basis for solidarity and collective action across European society. As Crenshaw explains, the goal is to facilitate the inclusion of the most marginalized group from whom it can be said, I'm quoting her, when they enter, all enter, right? It's very much resonate what Sylvia told. If one is sick, all of us are sick. And the current political landscape in Europe is replete with political minefields and traps, and offering rather an illusionary notions of inclusion and ambiguous answers to overcome the social exclusion of racialized people. And I think that's what we have to change in the academia. Thank you.
Thank you so much, Angela, for saying so many things in so little time. I'm just, let me remind people in the audience that they can make their questions through the questions and answer, okay? Because I cannot see any questions, so please do it, and we will try to answer from the panel. Agnès, would you like to?
Yes, I continue. Okay. I mean, I continue with maybe a bit of a different sort of take, because I'm sort of invertebrated policymaker, and so I mean, and my playground is very much Europe. So I mean, I'm going to be limited, and at the same time, not going to talk about only from an academic point of view, or less from an academic point of view. Basically, I mean, there are three things that we put forward in our sort of paper, in our G5+ paper, after sort of thinking about all the sort of possibilities. Where the three things which we're putting forward, just really sort of, I would say, headlines, right? Is the question, we want a caring Europe and a caring economy, which are two different things, but this is something we must really work for. Parity, I mean, gender parity is absolutely essential, much beyond what has been done so far. And we want to develop a new vision of growth. I mean, it's not to develop from scratch. As Sylvia said, there's a lot of knowledge which has been accumulated, not only by feminists, but as well by a number of sort of new economists also, and new schools of economists. I mean, we must sort of go away from that sort of pure competition type of neoliberal system to a system which is based much more on solidarity. So what are in Europe, I mean, I will come back to the question of the European semester, which Elisabeth was mentioning, and I think it's extremely important that we do monitor very closely with sort of civil society movements. We do monitor very closely what is sort of taking place with the distribution of funds, with the national recovery plans, etc. Right? But I would like to stress a little, I mean, before, what I see as sort of positive changes which have happened so far, right? Which we maybe tend to sort of forget. First of all, I mean, this is a massive recovery plan at European level. It could be more, it could be better done, etc. But this is a massive recovery plan. For the first time, I mean, let's remember the last sort of 10 years, 20 years, since the 2008 crisis. I mean, what has been, I mean, we've really sort of gone into the sort of liberal system. But then, as was mentioned, I can't remember by whom, I mean, we've got massive public service sort of investments. There is amongst the 27 member states, sorry, it's not 28, Sylvia, but amongst the 27 member states, there's been some sort of, with willing and dealings and so on, but some sort of understanding that there was a common future, right? and there was a need for solidarity. So that's one thing. I mean, there's a lot of grants as well, right, amongst these. I mean, grants allow for innovations for values and not innovations for profit, right? So, I mean, there's a lot of sort of possible openings, which are really important. The second thing is that we've got a very strong sort of gender equality infrastructure at European level, right? I mean, not talking about only the women's, the FAM committee in the European Parliament, or the European Commission, etc. We're talking about, now we've got adopted on the 5th of March, a very strong gender equality strategy with actual actors, I'm sort of hurrying up, with actual actors to sort of lead it. We've got leadership as well. I'm sorry, it is not the same to be, I mean, I worked under Barroso, it is not the same to work under Barroso and to have somebody like Ursula von der Leyen at the top of the European Commission. They do not manage the same way, right? So it makes a difference to have more women, and we do have more women in the ECB, 40% of women in the parliament, etc. And we must take advantage of this, because not only we've got women, but we've got feminists, and including some feminist men, okay? So just before I close down, I want to sort of mention the question of the European semester. I fully agree, Elisabeth, with the fact that the European semester is very, is something which we've been contesting quite a lot, which is sort of cutting on public services, which is wanting to rationalize, etc. But let's remember that the foundation stone of the European semester is in fact the Stability and Growth Pact, which has exploded, right? It's got to be completely renegotiated. It has exploded. The debt sort of constraints, which were at the basis of the Stability and Growth Pact, are no longer in force, right? So this is something which is going to be renegotiated in the next few months, and probably few years as well. And we must be there. And I'm very glad to see that. I mean, Mieke was mentioning Black Lives Matter, was mentioning the social movements which are taking place. There's a lot of women economists in particular, but not only feminists in general, or people who are into sort of innovation at local level, who are actually there to sort of push a decision by public institutions.
Okay, thank you so much, Agnès. So Elisabeth, please, and then we will see the questions. So please, yeah, Elisabeth.
Thank you very much. Oh, there's so much already said, so I will try to make it very short because we need time for discussion. Where shall I start? Thank you very much, Agnès, for mentioning signs of hope, like the new leadership, like the gender equality strategy adopted. However, we have to be realistic and see what happened. The gender equality strategy, nothing whatsoever has been reflected in the use of funds. And I really can say nothing whatsoever, because the priorities are simply not there in the later adopted program by the European Commission, in the whole next generation EU. So of course we need to struggle, and of course there is hope. There are a few feminists who work on it. Actually, currently the struggle is in, or the work is in the European Parliament and influencing member states, because right now these legal acts for all the different programs are being adopted. And of course there should be a refocusing. Building a just digital care-based green transition would be the call for now, and there's a lot of recommendations on how to do it. Like we in the study did even detailed legislative proposals. However, the situation is such that there is little area for hope because of the current division of powers. And we as feminists need to be aware of that. And so as a last remark, I want to focus on how to build a power for what you called for, I think it was you, Angela, but also Agnes and others, like for social justice. I think, Mieke, you also said, to reinforce agency for social justice. And what I think is really necessary is to put democratization at the center. And that has a lot to do to delink and denounce the European semester, because it is an entry point of neoliberal interests, as I have explained, to reduce public services to the interest of large companies who want to come in for profit making. And so it's this fight for democracy, and it is putting money and economic issues at the focus. There is already very strong institutions, like I like to say the UK Women's Budget Group or the Scottish Women's Budget Group and others who do a fight since a long time in joining forces, coalitions between researchers and activists and social movements. I think that's a way to go, because we need to bring knowledge, which is there. Thank you for mentioning before. We need to bring knowledge to the homes, to the neighborhoods, to actually, and build a mobilization to bring it also to the streets, to the workplaces of women, to reinforce this perception that what is needed there on joining, on jointly to build movements for like social justice. It's not going to be easy, but feminist struggles are and need to be at the center, because we see this combination of exploitation of the earth, of like with the effects on climate, exploitation of people, and heavily on women are at the core of like where the economic system goes. And so it's intersectional effects and struggles that we need to build. Yes, that's a plea for joining academia and social movements in building knowledge and mobilizing for building power to achieve the change. And we all know what we need, and it's there since decades, but not yet materialized. So by reinforcing our activism and the movements, I think we can change a lot. And I leave out all the recommendations in detail for the EU level, which can be read in the study. Thank you very much.
Okay. Okay. Yeah, thank you so much, Elisabeth. And I think we have only one question now. Maybe while maybe some other people can write some, I will just try to do a kind of a summary of many things that have been said. Very important, right, in this second round, because we have talked about how to transfer this gender knowledge and how to, I mean, to really go into and translate the nuances of gender. We have talked about epistemic justice. We have talked about, and probably who are we, and probably we can also think about this idea, and I think also Sylvia said something about that, that this is also an opportunity. I mean, it's a very pessimistic kind of thing, but also it's an opportunity, for example, to problematize privileges, right? So we are very, very much into this idea of knowing and recognizing all the privileges from very different inequality access. And of course, we need men, we need feminist men also really thinking about those privileges, but also we ourselves thinking about many other inequalities, including race and including age and all those things. And I think this call for epistemic justice that Angela was saying is really important. But we have also talked about the importance of social movements, which are there, and not only, I mean, to move with them, but also to put them at the heart of political science, and as our also a study of that, and increasing the agency of those people. We have talked about the need for gender parity, that it is still important there. Another vision of growth, clearly investment on care. That's very simple and not simple as Elisabeth was saying. And I mean, and all these democratization kind of things. So we have many, many things. We have only one question. Okay, let me read it. You have it there. Is how from Gustavo Elpes, and is how does the panelists see the future of social mobilization since collective encounters in a spatialized and discriminatory society might be especially marked in past, present, and probably in the near future by caring, assistance, and solidarity clusters. Does anyone see so different future and forms for the social mobilization and struggles for social justice in reason of pandemics? Thank you. And we have another question from Lut. I think Lut Meyer. Hello, Lut. Is that the we? I mean, talking about. Oh, sorry, I finally didn't see. I mean, I was reading this question. Sorry, I cannot see it now.
See it answered.
Okay. Okay.
Yeah.
Okay, so sorry, I did something. The we is also those who are working on service contracts that are policy support studies for EU institutions, like Sylvia and Elisabeth here. We need to feed gender knowledge also through such service contracts. I mean, it's a very interesting intervention by Lut Megert. So let's try to do, we really have very few moments. So I will give you the floor to say, I mean, in 1 minute, something that, whatever you would like to close, and let's do it in the other way around, okay? So finally, and try please to really stick to the minute. So Elisabeth, we will do it in the other way around. Elisabeth, yeah?
Oh, well, I think the point is, I said it earlier, it is really to be aware that without changing power and building power based on social movements, there won't be much change. Or if there is change, it's going to the wrong direction. We see that in any analysis at the EU level, at the national level. And I think academia has a large part in it, as I said before, to bringing knowledge and using knowledge for mobilization. And this feminist knowledge is essential. And I know there is this neoliberal principle of competition in all academia, which leaves little time, but we need to be innovative to think about coalitions of bringing researchers, academia, to play this role in building broad social movements based on lived experience of women. I think that's a core of building dynamics now. Thank you.
Thank you, Elisabeth. Agnès, very quickly.
Well, I'd like to maybe take up the issue of sort of what's happening at national level, right? Which is being asked in sort of question there as well. I do think that, I mean, social mobilization has really got to sort of be extremely sort of strong, including the sort of participation of academia in really being sort of vigilant about measures which are taken up not only at European but as well at national level, because this is where I mean, the distribution of money and power is going to be made. And so I've got no sort of, I mean, no magic formula, but I do think this is, if we talk about social mobilization, it has really got to be done at every level, and especially at national level.
Thank you so much, Agnès. Angéla, very quickly also, the kind of, you have to unmute.
So, a lot to say, but I think I really think that, you know, the crisis is really truly an opportunity as well, and I'm just thinking about, like, as our education system, you know, basically during one night we have to move online, right? And we have to change so many things in our educational system, and I think it's a time to open up to public education and going back again and think about what does it really mean and how can we create a connection with the wider public, and how can we make it more accessible for those who are left behind, and also how can we create a solidarity and link between social movements and academia. This kind of knowledge has to be transferred, and also I think it's a time to challenge this kind of binary, what we used to say that, you know, I'm a scholar, I am an activist. There is no such a things. We are an activist scholars. I think all of us, even though that we don't want to say or admit, but academia, doing academic work, that's politics as well, right? Because it's changing the discourse, changing the minds, and educating people. So I really hope that, you know, this crisis, it's just make us more aware that how much is important to work together with the social movements and mobilize people around us and give back and energize them and, you know, activate, but I mean, it's a wrong word, but somehow to empower them, even the empowerment, that's a wrong word as well. I don't know what shall I say, but really, bring back the agency, bring back the hope, have a new vision and hope. I think that's one of the most important things in our life. If we're gonna lose hope, then we're gonna fail.
Okay. Thank you so much, Angéla. This is a good thing. Mieke, would you like to?
I would like to join this. Yeah, I think it echoes a nice ending of an interview with Wendy Brown in The Drift. You can find it online, where she says that they ask her, do I have hope? And she says, well, hope is not something you have. It's something you have to make. So I think this is exactly in line with what you were saying, and this is, I think, one of the, let's say, responsibilities we have. So the crisis is only, I think, an opportunity either for those in power or for those who mobilize with or against those in power, right? So you can, if those in power are of a nature that you can collaborate with them, fine. If those in power are not of a nature that you can collaborate with them, you will have to mobilize against them. Otherwise, you have to mobilize to make them do something. But without mobilizing, if you're not in power, nothing will happen. So on the positive side, we see a lot of mobilization happening. And that's really good. So if we want to know more about hope and solidarity, we have to study those people who are mobilized. And we have to also, like, if I think about academia, like, in order to protect the politics of knowledge, we have to protect our universities. And they're under multiple attacks, especially social science and humanities already, and they never had the highest status in the first place. there's a wonderful article in Gender, Work and Organization. 3 UK scholars, Catherine Wright, Tony Hastrup and Roberta Garina, on equalities in free fall, ontological insecurity and the long-term impact of COVID-19 in the academy, where I think it also means we need to mobilize in academia. Those who have power in academia, they have to do something. Those with really bad people in power in academia, they have to mobilize against them or try to work with them. But if I look at the Netherlands, we have a manifestation next Monday with a cycling tour from university to university to pay attention to like draw attention to the precarity of so many people that have to move from university to university on separate short contracts. I think most of my colleagues don't even seem to know it is happening. So this mobilization is, so the question then is what kind of how do we like format our engagement as engaged scholars, right? What usually I go and speak to those people in power, right? Those things are not possible under COVID-19 measures. So how do I reach them now? I was supposed to go speak to the people in Finland. I'm not going to speak to the people in Finland. How do I do this? I don't know yet, but we have to try to find also new formats of doing this. So let me promise you that I'll contact the people in Finland again and say, well, maybe we Zoom after all, right? Better to speak than not to speak. So it's, I think it's also a way of contributing to a revitalization of democracy anyway, which is needed anyway.
Okay, okay. And yeah, finally, Sylvia, because we will need to close because there's another panel session after this. So please, Sylvia.
2 points. Data and knowledge. Knowledge is crucial. The marginalization of the knowledge that we have as gender experts has been most unfortunate. I recommend we get inside data science and all of the things which are called data, translate our knowledge into the forms of data which are powerful. That's not to change the knowledge that we have, it's to mobilize it more effectively so it can speak more effectively in the world as it is with the epistemic infrastructures which we currently have seeing developed. Secondly, on crisis, it's going to get worse. Maybe for those of you in the European Union who have Keynesian wonderful policies to support your economies, it may be not. But for the rest of us in the European periphery and outside of it, we're expecting mega recessions to follow on from the health crisis and the deaths from the health crisis. I'm expecting deep recession and that the crisis will take a new form and get worse. So when we're talking about the implications of what that means for how we think about the next steps, if we think about it as the deepening of the crisis and the challenges will deepen and the contestations will deepen, I'm expecting violence. My American colleagues are most definitely expecting violence in the context of a highly contested American election. We should be expecting the increase of violence not only as a consequence of the increased inequalities which COVID is generating, but as a result of the fragmentation and the fracturing of the forms of legitimacy which we've had. We should expect a rise in violence to fuel the rise of the crisis. For those of you who think this is an optimistic scenario in which crisis is a source of opportunity, I think that's fantastic and I would love to hang on to your optimism. But I think that this is a deeply challenging crisis and we need the comparative accounts from different countries and our understandings of what happened historically. 100 years ago in the last crisis, financially led crisis, but it was also followed on the 1918 Spanish flu epidemic, which also killed hundreds and thousands of people. That crisis then gave rise to a bifurcation in Europe between fascism and social democracy. There are many alternative outcomes from that crisis, and there will be from the next ones, and we need all of our scholarship and all of our alliances and coalitions. Thank you.
Sylvia, and we really are absolutely run out of time. So Thank you so much to all of you, 5 of you, especially. I think it has been, we have many ideas, and this panel was recorded, so for other people that they can watch to it. And thank you once again. So, okay, bye-bye.
Thank you for organizing.
Thank you so much for bringing us together and all this insightful statements.
Thank you.